So the two points of the muscle shrink, and the muscle loses its basic tension. And to compensate this, the muscle is getting tense. And as we age, for example, this tense muscle turns the chin up. So the face shortens, the chin shortens, and we lose the proportions of the face. So one of the most impactful treatment on the face is the cheeks and the chin. And maybe in the 8 years, I heard once that the patient came to me, I would like to improve my chin. Patients never ever see that and never ever raise that. You are the one who need to point out that the chin is something that we can work on. So the skin ages, the fat pads shrinking, disappearing, and there is a bone resorption. So overall, the fullness, the support beneath the skin disappearing, so skin collapses and saps. And what do we have? Obviously, we can take care about the skin with different things, and the daily skincare. I can't, talk enough about the importance of daily skincare. And as we age, we need to include retinol-based daily skincare. The second thing is Botox, which is really mind-blowingly beautiful. So Botox is really, if you put a gun to my head to say or to tell something bad about Botox, I wouldn't be able to do so. Really, it's just an amazing tool in our hands. And the fillers are my kind of favorite modality because that's really artistic. And when you work, so I'm really, I teach my daughter every day about gratitude. So how grateful we should be, and all of us sitting here in Harley Street, we all should be grateful for hundreds of things in our lives. But when I work in my private practice, and the relationship that you can build up with your patients in facial aesthetics is amazing. So we are like family, and they share with me things that maybe their husband don't know about. And I have a husband telling me don't tell the wife, and I have the wife telling me don't tell the husband, So and very good relationship, and I like to really separate the financial aspect of facial aesthetics from the medical, but it's you who has to say no to their money. So they are coming and doctor, please put one more syringe shape. No, I don't. And I leave a couple of hundreds of pounds on the table. Why? Because my signature is their face. And if I put that syringe into their face for the money, maybe I wouldn't sign my name under that face. And it's very interesting because it's a private club, and then I go to classes, and sometimes a woman walks in with huge lips, absolutely unproportionate for their face, and I pray to God nobody thinks that's my patient, So, yeah, because they know me, and maybe they think maybe she's my patient, and I pray to God nobody thinks that she's my patient. So facial aesthetics is really something that is amazing to do. It's artistic. You are in flow. The relationships with your patients is second to none, and artistic and rewarding and everything. So I tell you guys, it's absolutely the best decision to kind of start this profession. But what you need to know is the learning curve is very steep. There are so many things to learn, and today I'm just gonna give you a bird's eye look on facial aesthetics, because this one day is just not enough to really go into the details, and you need to research almost every slide versus a dedicated training course that you need to resource. And I remember during the first 2 years, I attended 36 training courses in the first 2 years of my facial aesthetic So we're gonna go into the muscles of the face, and my number one priority on the face with Botox is the frown area, because the thing that we really don't want on the faces is the frown lines. Because the frown lines give this angry look. So my Botox is going out. I still can't really frown, but I can frown a little bit. And there's nothing there. So every time that we frown, these lines appear on the face, and after a while they're gonna get engraved, and then it becomes very difficult to get rid of them. So hence we start Botox to prevent these line formations. So please frown for me. Okay, so with this one, I target the procerus muscle, which is here. And frown for me again. And with this one, I'm targeting the belly of the corrugator superciliary muscle. And with this, again, I'm targeting the insertion with of the same muscle. And the same on the other side. So these are our injection points, and this is a deep injection point, very superficial injection point. So what I do, I follow the muscles, I see how she or the patient uses the muscles, and I put my points accordingly. So now give me a brow lift, please. So patients can have high frontalis or low frontalis. So she has a high frontalis because all the lines running up to the hairline, but it's absolutely possible that the frontalis starts only to this height. So the lines just ending here, there's nothing about that. And also, lift, right? Yeah, so she has a kind of a full frontalis, but many times it's a V shape, so there's nothing at the middle. So really all of our muscles are different, and that's why we need to mark it up. And, okay, so show me a brow lift, please. So, it's a little bit difficult to explain, but as she uses her muscles, you can kind of visualize or imagine a triangle. This is how I approach it. So lift between the brow. So I kind of, if I put a point here, I see this triangle. So this muscle brings up here. So if I'm going to put my injection here, I'm going to relax the muscle here. At the middle and here. So with these three injections, the Botox spreads a little bit. Are you ready?
Yeah, I'm holding my breath for some reason. It's okay.
So you can relax the frontalis. If I see a very high frontalis and I can see movement up here, I might put points here as well. But many times I do the treatment like this, and then the patient comes back for the top up, and I see movement up there left. I'm going to put the injection there, and this is similar to the other side. And show me a squint of your eyes. So this is the orbicular oculi muscle, and this point. So no, it's absolutely not.
Nice.
And there is nothing done here, for example. So for you, I wouldn't put the full dose down here. And with this, I relax the upper part of the thank you very much. The upper part of the orbicular oculi. So it lets me to lift the brow, and these are the 2 points. Relax the orbicular oculi muscles so we can prevent the formation of the crow's feet, and the bunny lines will be here. And as we advance, we can talk about the Botox of the muscular muscles if there is an if someone is grinding their teeth, and there is an overgrowth of the muscle there. And these are not my patients; these are Maurizio's patients, and you can see that he is really very professionally set up with the whole studio. So patients in black, he's in black background, black hairbands. So it really helps to highlight the patients that we want to see, and look at the chin, look at the cheeks, look at the corner of the mouth, and look at the position of the brow, and He does this in rest and in animation, so she is smiling and she has to look good on every image. So it's not good if you look good on just in rest. When you smile, you need to look good. When you talk, you need to, when you kiss, look at the chin. On the right and the left under the chin eyebrows. Outing, tilting down. So the tilting down, so when you ask the patient to tilt down and look up, this is what really reveals the tear trough area. So then emptiness of the mid cheek. From oblique view, smiling, tilting, oblique view. So if you really did all the angles, you take 35 or 36 images every time. Look at the projection of the chin. Smiling. Yeah, and after the treatment, the patient feels more attractive, younger, and more feminine. These are the emotional attributes. Thirteen syringes of fillers.
That's what you said the maximum is 4.
Yeah, per session. So first session 4 syringe, other session 4 syringe, third session 4 syringe, we are on 12, and maybe on the third session we put in 5. But he did it in one go.
Yeah, we've been in the conference in Monaco.
Yeah.
That was for the demonstration.
And 4 syringes of Voluma, 3 syringes of Volift, 1 ml of Volbella, no Volite, and 5 ml of Volax. Split over multiple sessions. So this is very important to show to your patients. These are tablespoons. And this is 1 syringe in a tablespoon, 2 syringes for 16. So 16 syringes is 1 tablespoon worth of fillers, which is not a huge amount. Another case, 10 mils of syringes, but the 10 mils of filler. Look at the chin, the cheeks, the lips. Male patient, wider, stronger chin, stronger cheeks. Look at the angle of the mandible, look at the contour of the mandible. And very interestingly, so this is 0.7, remember the angle of the mandible injection. Tip of the chin injection, C1 is the nasal labiomental crease, and he put some filler in, but nothing, there is nothing here. So you can gain this contour look by treating only the angle of the mandible and the chin. And this bit falls in place without touching, because these two angles stretches this big part. And the facial artery runs here anyway, so you don't need to go close to the facial artery. Another case, look at the chin again. 15 mils of fillers. And this is my favorite case. She's 45 years old and look at the chin. 16 mils of filler. Look at the lips. She needs Botox for sure. And she's a hyperkinetic patient, so she's not an easy Botox patient. Because she's in rest and you can see how active, hyperactive the frontalis is picking up her brows. But look at the under eye, look at the tear trough, look at the cheeks, the mouth, the chin.